Welcome to Leaders' Questions.
Gurmil Margaret, Elaskan Corlia. Taoiseach, I too want to offer my deepest sympathies and the sympathies of Ain to the family of Kevin Flatley. This is a disaster for Kevin's families and friends, and it's also a disaster for the state, that 90 Gardaí have lost their lives in the line of duty since the foundation of the state. Many families fear when their parent or their loved one goes out to work that they mightn't see them back, and yet those families still commit to going out and working for our safety on a daily basis. Taoiseach, in terms of the healthcare system, on a daily basis, families are struggling to get healthcare for their children, and the dysfunction in the healthcare system is leading to enormous delays and enormous difficulties for those families. And here we have a situation where families actually manage to get operations for their children, and we find out that in many cases those operations were unwarranted and unnecessary. It is a major problem currently within the state that we have children who may not have had reached the threshold in terms of hip surgery, or maybe didn't suffer from hip dysplasia in the first place, having potentially operations carried out on themselves. I understand as well that currently in the audits over the last 2 years, there's about 561 people have been included in that particular audit. But if the audit is going back 15 years, on those terms, we could be talking about thousands of parents and children who will be part of this particular audit. I myself had to leave a son in an operating theatre for a procedure not as serious as the ones that we're talking about at the moment, but I saw the fear in his eyes before I left the theatre, and I also felt very difficult in leaving that location. But you can imagine the fury that must exist amongst the thousands of parents who left their children in very difficult circumstances in a situation where potentially those operations were not necessary, where potentially those operations could have damaged those individual children. All operations have challenges. Infections are possible. Surgical trauma is possible. You know, it's a very serious issue putting a young child under an anaesthetic in this country. Now, today, potentially thousands of parents have been left in limbo, and for many there is an excruciating absence of information, and this is the real difficulty for them. The questions they want to know is, how did this happen? How can hospitals carry out a particular operation at a rate of 5 to 10 times more than the population of that country needs, and nobody seemed to be able to pick up on it? What are the government's structures that allowed this? Where is the leadership in the particular hospitals that this happened? What is the culture that facilitates this? And where was the CHI and Ministers for Health over those 15 years? The Department of Health are responsible for all those aspects of our health services. You know, the idea that, you know, we are asking parents to be confident today Deputy, in relation to what's happening to their children today, yet we cannot tell them what happened for the last 15 years to the children. And if the idea of this audit Deputy. Is to try and make sure that this never happens again, surely there's an urgency to make sure that that audit is complete ASAP. When will parents know what happened to the children?
Thank you, Deputy, for raising the issue. And could I just, in line with Deputy Batchick, and I omitted to do it earlier, to also express our deepest sympathies to Emmanuel, the family of Emmanuel Famiola, and the family of Matt Sabanda and the community in Donegal for the very, very sad, shocking drownings over the weekend. Two young teenagers with their friends enjoying themselves, which made for a very, very sad weekend altogether. Could I say, in respect of the issues raised by the Deputy, the audit is not going back 15 years. The audit that's currently being conducted is a random anonymised sample of patients aged 1 to 7 years from 2021 to 2023. Now, letters have issued from CHI and CAPA to parents, but that's not an audit. Letters have issued. The actual clinical audit by the external author is, as I've just described. And we do really need to await the completion of that audit. I do accept the concerns, and I appreciate that the absence of completion here or information can compound anxiety for parents. And that is why it's important that we get the complete audit and that we are in a position to share it with the parents, with the families, and indeed with the Oireachtas also and the public at large, and then that an action plan would then be implemented and published also to deal with that and to work with parents and with patients. Again, I can't draw conclusions until I see the final report and until the Minister sees the final report. But again, the implications are disturbing if indeed some of the assertions come home to be the case. In other words, or emerge to be truthful. I think there are issues already, as I've outlined in an earlier reply. Changes to practice and protocols has occurred in terms of multidisciplinary approach, in terms of preoperative assessment, and that clearly wasn't there, it seems, in advance of this. Cases are now being reviewed by a single team of clinicians from CHI and CAPA before a decision for surgery is made, and that process has been in place since early March of 2025. And of course, as I said earlier, in many cases, if a child is operated, say as far back as 2010, that child would still be getting checkups right through to the teenage years, as well as up to 14, 15 years of age. One would routinely would have follow-up in respect of such surgeries, and indeed other surgeries as well. That's not uncommon. But until we get the report complete, and I think I favour the completion approach. In other words, get the full audit out, get it published, get it shared, and we can act on it then.
Deputy Tóibín.
See, Taoiseach, there are major problems within the health service that you can act on now that have led in part to the difficulties that we're suffering. There isn't proper data collection in Irish health service at the moment. There isn't a proper digital patient number within the health service. We don't have a good register of information currently within the health service. The capture of outcomes is not valued within the health service. We don't actually track patients in a similar fashion that other jurisdictions do to be able to flag these situations if they should arise at all. So fixing those particular issues would actually extremely benefit patients within the system and make sure that these issues don't happen in the future. And actually that idea that we would actually start to track and maybe even pay hospitals for their activities and for their outcomes instead of the manner that hospitals are paid now would be beneficial to making sure that money doesn't get lost in the front line and get caught up in layers of administration as well. The worry I have at the moment is right now, have all parents who potentially could be caught up in this particular scandal in the last 15 years, have all of those parents been contacted? What is the depth of information that they have received? Is it a generic letter, or have they been given specific information to their own cases?
Taoiseach.
Could I first of all say that in relation to your general comments, I mean, a lot of advances have been made in our health service as well, Deputy, huge advances. And in fact, we know through the various layers of management on hospital sites now that there's huge data being collected in respect of individual patients once they enter into a hospital, once they go in for particular treatment. There's a lot of information garnered in respect of every individual patient nowadays. There is a need for further investment in digital health, electronic patient records, and we are going to allocate in the upcoming National Development Plan substantial funding in addition to that already spent in relation to that issue, because that is necessary. But the health vote at the moment in 2025 is 25.8 billion. 25.8. It is getting to the front line. It can't be that sort of superficial, but of course it's going to the front line. Like we need to. Sorry, there's 25.8 billion allocated to health in 2025. That's 6 or 7 figures ahead of 4 or 5 years ago. We do need to, the value for money thing needs to happen as well. And there'll be another fine day you'll be in here, so on, rightly raising those issues, right? Can't have a boat weight though. So it's not always a question. And we will be allocating more to health. But we do need to analyse it as well. And we accept separately from the normal funding into acute services and tertiary services, we need investment in the digital health area.
Thank you, Taoiseach. Now move on to the order.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.